Book 93 of 2019 was Bad Pharma by Ben Goldacre. So this book is basically talking about how we can't trust the pharmaceutical industry, which I think, given like the climate of today, it's a bit obvious to people now. But I think that this book probably came out and was instrumental in kind of opening people's eyes to the dire practices of the pharmaceutical industry. You would assume, wouldn't you, that medicine was like evidence-based, that the doctors that were practicing medicine were aware of all the literature and what drugs were effective and what weren't, and what were the best things to use to treat patients. But Goldacre kind of discusses that even though doctors try their best, they're kind of being hoodwinked almost by pharmaceutical companies who don't really kind of present their trials on drugs and things in a way that is not manipulated for kind of like economic gain on their part. So it's really difficult for a doctor to kind of prescribe something that's actually right for the patient. And Goldacre actually cites an example of when, as a doctor, he tried his best to provide a treatment for a patient of his, and he prescribed something that he thought was best for the patient, and it turned out not to be, because there wasn't enough transparency from the drug companies, and it's worrying that people are being prescribed drugs and people are taking drugs and thinking that they're all good for them, and they're not. So it's quite worrying, particularly places like America, where everyone's on something, aren't they? And particularly as well now with mental health, people just pop pills all the time, and it's kind of just like, oh, you could actually be making yourself worse. So it was an interesting book in terms of going through things. Personally, for me, my background is a science kind of discipline, where in order to kind of analyse research, you have to kind of have evaluative kind of way of looking at research, and so you have to kind of develop those skills before you even become good at your subject. So when I was kind of going through it, I was kind of thinking, I actually know a lot of this stuff already, because this is what I would criticise psychological research with, to kind of see whether or not it was valid. And so I'd think that these were kind of critical thinking skills that surely most people would have, but obviously not if this book has a market and people think that it's amazing. Like, a lot of people have recommended this book to me, but when I was reading it, I was kind of thinking, did you not know all this stuff already? I mean, there was a few things in there that I didn't know, and so it was kind of interesting for that reason. But generally, it's kind of like obvious stuff. So I'm kind of talking you through it. We start off. Goldacre starts talking about publication bias. So this is a thing that happens all the time when research is done, that you're more likely to get a positive result published than negative results. You don't often get negative results published because the logic behind it is that you didn't find anything. Now, that's a problem, because if you don't publish that, then no one knows that it's already been done, and then you end up with a lot of repetition of things, a lot of things being done again that have already been found to not be the case. It would be very useful to have those things published so that you would know that it's not good to do it again. And there was an example of where this happened in medicine, where it's obviously more crucial. There was a trial called TGM 4012, and when this drug was trialled, and it was trialled, following all the guidelines, where they only gave it to a couple of people and did it on a kind of short-term basis. They had respiratory failure, and they had blackened limbs. In actual fact, no, what am I thinking? That actual trial it wasn't given to just a few people, and it wasn't given like at certain time points, which it should have been. And then they had all those results. But what was actually missing in the data was that this trial had been done before on a similar kind of drug, so a similar kind of molecule, and they'd had these effects. But in that trial, they'd only done it with a couple of people and over a short term, and it hadn't been published. So this other drug, the TGM 4012 trial, can't remember exactly what drug they tried, ended up being catastrophic for those people that were in the trial. And it was unnecessary, because they'd already done trials before and found something similar. So it was just like, what a waste of those people's kind of health, like, what a ridiculous thing. So what Goldacre is suggesting is that this can be like avoided in the future, in the sense of every kind of drug that's trialled, even if you find, not something that's not published about it. It should be registered. It should be registered that you're going to do a trial, and then it should be followed up what the outcome of that trial was, so that if anybody else needs to trial a drug that's similar, then they know what kind of side effects to like expect from it. It kind of makes sense. Like, why is this not already kind of, you know, out there for people to kind of avoid doing things like this? It's bizarre that this has gone on and it's not been changed or regulated, or, you know, government hasn't got involved, or it's just, you know, it's just bizarre. But obviously there's a lot of money in it, isn't there? So, you know, they get away with whatever they want. So it was talking all about this publication bias and how this is a problem for sciences, you know, in general. And then Goldacre kind of talks about as well about how when there's been systematic reviews, so, you know, unbiased reviews of things that have been trialled, there is a comparison of company-funded drugs are 20 times more likely to show that they're effective in comparison to if they're independently or governmentally funded. Now, that would kind of suggest that they're not necessarily more effective, but just because they're being like funded by, you know, pharmaceutical companies, that they're more likely to kind of get onto the market. And there's you know, some example of the publication bias where there was like 2 positive results found for the drugs being effective that were published, but there was also 7 trials of unpublished results that found that they weren't effective. So any logical person comparing those would go, 2 of them found it was effective and 7 found that it was ineffective. I don't think ineffective is a word, is it? But anyway, so 2 versus 7, what are you going to believe? You're going to believe that, you know, the 7 negative results, but they weren't published, so no one knows about them. So the only ones that they're seeing are these 2 ones that say that they're actually, you know, that it's actually effective, so that people are going to use them, because doctors, when they read those journals and they see that they're an effective drug, they're going to use it. But they don't have the unpublished 7 trials at their fingertips to know, common sense wise, to you know, think that that drug is actually not as effective as it's being manipulated to show. Similarly, there was, for psychiatric drugs, when it was done by pharmaceutical companies, there was a 78% effectiveness rate compared to a 40% effectiveness rate if it was independently or governmentally funded. Now, you've got a drug there that's 40% effective. Now, I'm not being funny, but if I was told, right, okay, you can take this drug, but it's only going to be 40% effective, I wouldn't take it, because what's the point? Like, chance is 50%, so you wouldn't go for something that's 40%. Now, the fact that that's the same kind of drug that's being found to be effective and not effective, but just dependent on the person that's funding it, depends on whether it is effective or not, then there's something going on there that's not quite right. And I think, you know, in general, like, drugs regarding mental health anyway are you know, sceptical for things like, obviously, for things like schizophrenia, it does help. Like, it does have, it does help reduce voices and things like that. So obviously that, you know, that you could warrant taking that as effective in that sense. I mean, it does kind of make people quite comatose and whatever else, but it does get rid of the voices, and if the voice is telling you to kill yourself, then that's obviously a better quality of life. But for things like depression, you know, there's this whole kind of serotonin hypothesis, which has not been scientifically proven. You know, your depression is not caused by a serotonin level in your body like everybody thinks that it is. There's no actual evidence that suggests that. You know, there might be some that's funded by pharmaceutical companies that want to sell you the serotonin drugs. Well, serotonin reuptake inhibitors, they're not actually serotonin that you take, and it's an inhibitor of the serotonin in your own body. Your body makes serotonin, but anyway, it's not necessarily effective. So you've got all these people popping pills thinking that it's going to solve all their life problems, and it's not, because the drugs aren't effective, and you're being hoodwinked by pharmaceutical companies that are making lots of money via you, because obviously it's NHS, so you don't necessarily have to pay for it, or if you pay for it, it's, you know, reduced costs, but the pharmaceutical companies are making a lot of money from it. So it's something that really needs to be kind of like considered and looked into. Goldacre also kind of discusses about trial designs and how, you know, the essence of drug trials is that there's always going to be problems, because you have to trial drugs on a small population, because in case of side effects or whatever, and even when you kind of increase, you know, say you've done basically it gets tested on animals first, like rats and whatever, and then when the rats don't die and they show kind of positive responses to it, they might trial it in like a couple of humans, and then if it's okay in a couple of humans and there's not like loads of side effects, then they'll kind of make it into a bigger sample and so on and so forth, and like, you know, increase it. But still, you've not got a massive sample ever when you're trialing drugs, because you know, it's not practical to do so. And so is it actually going to be effective in other samples. And a lot of the time as well that you have like them sampled in Western countries, so they've not been trialed in people that have different like race and heritage and all that kind of stuff. So it's probably, you know, unrepresentative of everybody in the world. So you can't say that these drugs are effective for everybody, and everyone's going to have kind of different side effects and things like that. Goldacre also talks about the ethics of drug trials, because a lot of the time drug trials are you know, you get financial gain from them, so you're attracting people that are in the trials for the money. Now it kind of Goldacre kind of cites some examples of people who were in the trials, and because they needed the money, they kind of went along and did things and kind of almost like downplayed their side effects that they had. And so obviously there's a proper ethical problems with that. You know, should these people even be in the trials, and you know, should it be, you know, financial gain, but then you wouldn't have anybody wanting to volunteer for it and all that kind of thing. And as well, the other thing is, if these people, you have like people who do it as like a job, like they just do lots of trials, what's the impact of them being in one trial and then being in another trial, and so on and so forth, particularly for things like demand characteristics and like acting in a way that you think that the people want you to behave. And obviously, like I said before, about downplaying those side effects, it means that what you're going to get is not actually valid results about the effectiveness of that drug. Similarly, what they tend to do is they instead of having like so they'll have like one drug that they're trialing, and then they'll compare it with another drug that they know has got known side effects and they know that it has a negative impact. And so when you compare the two, it inflates the fact that that one's effective, because in comparison, obviously, if it's a negative one, it's not like you start starting at zero, you're starting in negative and then it's increasing to that effectiveness, that positive effectiveness, so it looks better. So they kind of manipulate things like that. And then similarly, a lot of the drug trials are short term. There's no kind of long term follow up. So whilst it might be okay in the short term, it might have long term effects that, you know, you don't even know about. You know, all this thing about, you know, taking drugs for mental health issues. There's no long term evidence about the effects of these drugs on the brain, like at all. Like, you know, these serotonin reuptake selective serotonin reuptake inhibitors, there's no long-term research about it. Like, you could literally be ruining your brain by taking them. Now obviously, if it's going to stop you from killing yourself, then great, keep taking them, you know what I mean? Like that's obviously going to be better for you. But if you've got mild anxiety or you've got mild depression, you shouldn't be taking pharmaceuticals for it. You should be getting therapy. So, you know, you should be really thinking about that. Also, what they tend to manipulate as well when they're doing drug trials, and they're trying to say, oh, the effectiveness is better. Like, so for example, they'll say, oh, it's got a 50% increase in effectiveness. But if you actually look at the numbers, it'll be like before it was 0.012 and now it's 0.024. So there is a 50% increase, but they are minuscule numbers. It's like, you know, a lot of people are really bad at maths, aren't they? And they don't really understand numbers and things. So they get hoodwinked by statistics a lot of the time. And it's like, yeah, there's a 50% increase, but it's very minuscule, like when you actually look at the numbers. And because nobody looks at the numbers, because, you know, they don't really have that kind of grounding in numbers. They tend to just believe like how it's being presented to them rather than looking at actual raw data, because obviously that takes a lot more effort. Goldacre also then talks about patented drugs and the difference between those and non-patented. So basically, if you've got a patented drug, when it's in patent, it's more expensive. And then when it goes out of patent, it's cheaper. Now, what tends to happen is that when a drug's going out of patent, you have like the molecule, and then you have kind of like, I think Goldacre says it's like left and right versions of the molecule, which haven't been patented. So once the whole one's out of patent, then they can patent the left one, and then they can patent the right one, and then they can make more money. And it's the same molecule, it does the same thing, it's just a different kind of version of it, but it's the same kind of like action on the brain, or action on the body, depending on what it's for. And so, you know, it's like they're just kind of recycling to get more money. And also, there's been cases where the old drugs that are out of patent are actually more effective than the new ones that are in patent, but because the ones that are in patent are being kind of advertised, and, you know, reps are always like trying to get doctors to, you know, endorse their drugs or whatever, and kind of are almost friends with them, and so they're always mentioning the drugs that they're doing or whatever. So it's not even in a kind of like explicit way, it's like an implicit, like, you know, if you know somebody and they tell you about what they're up to and what drugs they're kind of doing, then that might be in your mind when you then go and prescribe them to patients. And so, you know, you've got drugs that are probably better for you, that are, you know, that have been used for years and have been found to be effective for years, not being used because they're not the fancy like drugs that are being advertised. You know, Goldacre cites examples of people in America who go into the doctor and want to be prescribed a particular drug, where because it's like patented and it's advertised and there's lots of media behind it for money purposes, but actually there's other drugs that are more effective, and there hasn't been those comparisons between the out of patent and the patented drugs because it doesn't make economic sense for the pharmaceutical industry, and so you end up with drugs that aren't as effective on the market, and these aren't kind of being tested and, you know, done by government, which you'd think that they would be. And so Goldacre also talks about these pharmaceutical companies and how they're very manipulative in the sense of they fund a lot of doctors, particularly in America. And so they all have kind of like ties to pharmaceutical companies. So when they're kind of doing like conferences or they're doing like research papers and things and they're publishing those journal articles, they'll say like drugs are effective when they're not. And there's actually been cases where the companies have actually wrote the articles for them and they just want the name of the doctor to kind of give it some kind of credibility, or there'll be cases where they want the doctors to put their name to it but they don't allow them to look at the data that is supporting it, and I don't know how as a professional that they can do that, because that wouldn't sit right with me to be putting my name or my credentials to something that I haven't got full understanding of. And but then it works for the doctors because then they get more money and they get more known, and their articles get published more because they get used more and well, cited more, I mean. And as well, these pharmaceutical companies put like lavish events on and invite like doctors and medical professionals and to them to kind of woo them, and like I said before, it's like an implicit way of, you know, selling their drugs, and it works. And yeah, when you read it, you kind of think, I'm never taking a drug again. I'm never taking any pill again, because how would you even know that it was effective? Like, unless it's been, you know, shown to be effective across a long time, like how can you trust any of these new drugs? Because they might just be less effective than what was already on the market. So, you know, it's well worth reading if you know nothing about kind of like science and how it can be manipulated and how numbers can be manipulated to kind of show kind of what you want it to. And it was interesting to find out about how like these pharmaceutical companies are making absolutely loads of money and it's not being regulated, nothing's kind of really being done about it. It's kind of something that government should really be looking into and really be doing something about, because it's a monopoly, like, you know, they're making loads of money at the expense of people's health, and so, you know, it's something really important that's kind of not having anything done about it. So yeah, it was interesting for that reason. But like I said, a lot of the stuff I kind of knew already, and so I was bored through a lot of it because I was like, well, yeah, and it was interesting to find out about some of the cases that have happened, but it's quite scary, like listening to it. It's like, oh wow, like if I ever get ill and I've got to take some drugs, I'm going to be quite worried about it. And it's reminded me, actually, I went to hospital a couple of years ago, because I thought I had like a potential blood clot in my leg, because I was taking some medication and I'd reacted badly to it in the past. I had a mini stroke, and so I wasn't really supposed to be taking it, but I took it anyway for other reasons, and I was told to watch just in case, and so I went to the hospital and I was like worried about it, probably a little bit too worried than what I should have actually have been, and the doctor prescribed me warfarin, which was to thin my blood, and I was just like, I'm just coming to you to ask if it's a problem, like if I have one or not just give me blood thinner anyway, like, you know, that could have negative impacts on me in other ways. And he just didn't even care, he just prescribed it me anyway, and I was just like, I have warfarin, and yeah, like, so anyway, that's the book. Read it if you like.